So within the South Asian community, how is mental health gauged?
Right. So, like, that's such a good question. And like, I don't want to generalize like how it is within the whole community because there's like a billion of us.
Of course, of course.
um, but I think in general, feel like mental health is looked at as something that you keep under wraps and you don't really discuss with people, right? If your kid's going to therapy, it's generally looked at like, oh, they're a problem kid or something's wrong or they're struggling with something. So like you're not telling people, oh, my child's going to therapy. Or even as like a young adult or a teen, you're probably being told not to say it, and you're probably at least like the last 10 years, like you weren't that comfortable discussing getting mental health, if that's even something that's happening in the first place. Usually it's more like going to your imam, right? Or like maybe going to family and community, going to an elder, going to your cousins, keeping it within the family. In collectivistic communities, it is this feeling of going to people within the community to get that solved, right? Or making it like a family meeting. If again, so like I'm speaking now, mental health therapy, if that's happening, it's probably being done in secret because it's something that's ashamed of. Now, talking about the family, if it's even happening within the larger aspect of your family, that's a bigger thing. And if it's even being discussed in the first place and being acknowledged as a whole thing. So there's so many layers before you're even talking about discussing mental health, where there's so much more placement on protecting family and community and those factors.
I agree with that so much. If you like, yeah, as you said, I really want to talk about how you're saying under wraps. It's true. It was like a family secret. You
Yeah.
know, you can't let people know about that because then it brings shame to the family, right? Like because mental health wasn't really touched upon during that time, it was as if those were excuses. That's another thing too, right? If you felt ill, those are just like mentally ill excuses. You had to get over that. So therapy, they had to because it was shameful. They didn't want people to be like, why are you wasting time on that? Why are you wasting money on that? Why is your child a problem? Why didn't you raise your kid properly? Things like that. It's
Mhm. What are
yeah,
you doing wrong? What are you
yes.
doing wrong as a parent, right? Because everything goes back, your reflection of your child is a reflection of you as a parent,
It's
right?
true. Exactly. Especially when you know how you were mentioning before, immigrant parents come here and they want to provide a better life. And if their child is not in a better position as they should be, right? If they're not successful or anything like that, yeah, it goes back to the family. I mean, we can all like it's okay. We know our immigrant families and their extended family. Okay, it's gossip central, all right? They got little group chats and they're all talking about each other. And oh my goodness, I feel bad for them. Okay, I feel bad for them. The, they're as bad as the '90s kids we were talking about. So I know for sure. Yeah, I know for sure that they must be like,
So
yo, my
imagine
kid's
that.
fine.
Imagine that, a bicultural identity where it's like you're going to get picked on at school or you're going to be talked about at home. Like it's,
Yeah,
you can't win. Where are
yeah,
you safe? Where are you safe potentially with the therapist? No one's talking about going to therapy. No one's, and even accessibility to therapy. Like that's still difficult now, to be
it
honest. And
is.
it is. It's not easy to find a therapist, right? Going through insurance companies and all of that. But back then, that wasn't even a conversation, to be honest. It wasn't.
Yeah, it's
Yeah.
true. Like even now, some benefits are finally starting to. Like I'm lucky mine does. I've yet to use it though, which I should. But oh my goodness. But like at the time when I did need a therapist, it was covered. We have like healthcare, and it was covered. Now not. So our thing constantly changes. And it's one of those regressions almost. You can think of it as like, oh, why is that taken out of healthcare now? Oh, all of a sudden now it's not an important thing, yeah, so
Mhm.
on and so forth, right? So it's difficult, but I'm glad to see that it is evolving. It's just that unfortunate with some of our like the age of our parents and that whole demographic, it it might be a little too late. Some of them do take on and realize and they adopt the change. Many of them are still adamant that hey, you could just be better. You could wake up better.
Right.
Yeah.
You have to be in a place where you can accept that we came from a place when it was a privilege and it's still very much a privilege, right?
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth led projects, visit us at youthspeak.ca where you can donate and spread youth mental health awareness.
YouthSpeak Performance Charity. Speak, inspire, change.